in the midst of this global pandemic, uh, prepare for your health insurance costs to go up. So now, a new study is warning that we will soon see a gigantic spike in healthcare costs due to COVID 19. Now, the research was conducted by Covered California, the state insurance marketplace created under the ACA. And it says that if carriers must recoup 2020 costs, price for the same costs next year, and protect their solvency, 2021 premium increases to individuals and employers from COVID 19 alone could range from 4 to more than 40%. The health and economic impacts of the coronavirus outbreak are, quote, potentially staggering, the analysis states, and could result in even more consumers and employers no longer being able to afford coverage, leading to employer groups dropping coverage or individuals deciding to go uninsured, which, of course, in the middle of a pandemic, not good. Very bad, terrible idea. It's almost as if this employer sponsored health insurance thing was a bad idea. And this private insurance thing, an even worse idea. It's almost as if we could benefit from Medicare for all. Now, there's more. We know, of course, that more than 80 million people are either uninsured or underinsured, 27 million uninsured, and the rest have insurance, but they can't afford the deductibles. They can't afford their copays. And so they generally choose to go without checkups or needed health care unless it becomes a life or death situation. And in those situations, of course, are much more expensive than taking preventative measures. And so what they're doing is that because the system is, so broken and prohibitive, they're actually making it more expensive for regular people to go and get checkups and making the system more expensive for insurers. And so it's just a problem all around with private insurance. So now the impact, according to Peter Lee, executive director of Covered California, said the impact of COVID-19 will be significant. Absent federal action, consumers, employers, and our entire healthcare system may be facing unforeseen costs that exceed $250 billion. And of course, all of that cost goes to us. It goes to us. It's not just eaten by insurance companies. That is directly to consumers, right? In fact, he continues by saying consumers will feel these costs through higher out-of-pocket expenses and premiums, as well as the potential of employers dropping coverage and shifting more costs to employees. So these increased costs, finally, he added, could mean that many of the 170 million Americans in the commercial market may lose their coverage and go without needed care as we battle a global health crisis. These are not insurer costs. These costs directly borne by American citizens. And so this is the result of having a healthcare system that is literally based on profit of the insurance companies, right? We could have a system where we don't have premiums, copays, and deductibles. But, I mean, unfortunately, the guy who's pushing it yells too much and puts his finger in people's faces. I mean, as opposed to the other candidate allegedly putting his finger somewhere else. I'm not going to get into that. But, I believe Tara. Look, anyway, it's a ridiculous. It's so ridiculous that in this moment, people are making the argument that this kind of system that we're currently in is great, and that we should, we should totally continue to keep this system that has been broken for a very, very long time. It was broken before. It is broken now. It is even more broken in the middle of a pandemic. We cannot stay the same. We have to continue. We have to push for Medicare for all. And the thing is, I know centrists will always say the same thing. It's not time. It's not time to push for bold progressive policy. No. We have to protect what we have, because the Republicans are coming for it. And while that's true, Republicans are always coming for it. That's not a good excuse to not push for better, right? And you can look at what's going on in other countries, right? Other countries' conservatives are just as conservative. Okay, maybe not quite as conservative, but they're just as interested in pleasing donors. they're just as interested in helping corporations, right? None of them would even dream of taking away their socialized healthcare. And you know why? It's because it works and it's because it's popular. They would get mauled at the polls. So it's a lot like how Social Security and Medicare, I mean, even Republicans at this point, because it is so popular, Republicans have to come out and lie to you and say, don't worry, we're going to be the ones to protect Medicare and Social Security. Now, of course, they want to cut it behind the scenes. And Joseph Biden, who is the Democratic frontrunner right now, even he has argued in favor of cutting Medicare and Social Security, right? And there's videos of him on the floor arguing that point of, yes, we should absolutely do that, right? And so, I mean, these things are so popular that nobody wants to touch them out in the open. We need to make Medicare for all. First, we need to get Medicare for all. And then understand that we will not have this conversation about, oh, the Republicans are coming for it. The Republicans are coming for it. Once we have it, because it'll be so incredibly popular that they won't be able to touch it, at least not openly. But it's ridiculous that we have a system that we have now and don't actually have universal health care. And we all know the answer is because of private interests. These private corporations, they give money through lobbyists to these politicians who already have health care through the government, and they deny us, the people, from allowing from basically getting the same benefit, and that should be unacceptable. It is unacceptable, and now is the time to take bold action, because if not now, when? I mean, pandemic literally happens once or twice a century. Now's the time to push for Medicare for all, because it's exactly what we need in this situation. Because if we can't get it now, when times are at their worst, when unemployment is spiking, when healthcare is a necessity, when people are starting to realize, oh man, it turns out they're right, we do need healthcare, national healthcare for everybody. If we can't get it now, we'll never be able to get it. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.